Try to do it vertical so they don't watch a sideways video.
It's like this?
Horizontal, yeah, sorry. Oh, so this is where I'm stuck.
So she's got pain here, and she's pretty stiff there through the lower lumbar spine. So we're going to go ahead and use a technique called dry needling to see if we can get her some more motion and less pain.
That's good to pull it down just a little.
Sure. So I'm going to go ahead and clean the skin. Dry needling is a fairly new technique for physical therapists to be doing in the States, but I know one therapist in Delaware, Jan Damerholt, who's been doing it, maybe it was Maryland, been doing it for a while there, 20 years. But other countries have been using dry needling for a while. The simplest way that I can convey it is that we're reallocating muscle tone. Think of the nerve and the muscle as a bioelectrical unit. And so when I take a stainless steel needle, a conductor of electricity, and put it through that system, I get a twitch response, which is an actual reflex. It's subcortical at the spinal level. And I can get muscles to relax. Or if when I have the needles, let's say for example in the spine, I can upload stability by using electrical stimulation through the needle. Of course, you've got to know your anatomy really well.
So it's almost like a nervous system reset for that muscle.
Yep, and I'm taking the needle all the way to the transverse process of the vertebrae.
And so why do needling as opposed to using your hands or tools to massage your back?
Well, particularly with the spine, because there's a lot of layers of muscle tissue. So this needle is going to go all the way down into the multifidus, which has been well researched and is certainly an important layer of muscle. Superficial manual therapy techniques are just that, they're superficial. So in my professional experience, dry needling has been the quickest and most effective manual therapy reset that I've ever used or seen.
And so you said describing dry needling as reallocating tone. So is it possible to use dry needling on inhibited muscles as well?
Sure, certainly. Yeah, when we attach E-stim to the needle. I'm going to go ahead and change size. So the difference between this and acupuncturists, first off, traditional Chinese medicine practitioners do a lot more than just needling. Secondly, when they do needle, they do it based off of meridians. So the justification for where they put the needle and why is very different. I'm going based off of anatomy, palpation, and the patient's movement, their physical examination.
And how does this feel, Lauren? What's the sensation of being needled like?
Well, let's see. I've been needled, like 6 or 7 times, Don?
Yeah.
So a lot. So I'm pretty comfortable with it now. It was a lot less painful than I had anticipated the first time I did it. I'd never had acupuncture before, never had any needles in me, so I just basically feel a light pressure when he puts the needle in, and then I feel the muscle twitch from, I guess, the electrical activity. Don could probably be clearer about that, and
Right,
I don't
which-
really feel anything.
Which is, it's kind of cool when you think about that twitch response, latent twitch response, is it's actually a reflex. So as I said briefly earlier, it's subcortical, so it goes to the spine and then comes right back, just like a patellar tendon reflex. So you get an immediate reduction in tone.
Yeah, I definitely already feel more relaxed. That one was more
Yeah.
painful.
Twitch is even down there, Lauren.
I know, I twitch everywhere. Twitch monster.
So this is hitting rector spinae. This is hitting multifidi.
Mm-hmm.
Going through several layers here.
Gotta love your anatomy.
It is interesting. I don't know of like that many treatments that directly can impact multifidi that way.
Exactly.
Well, let's put it this way. I had spent hours in physical therapy before seeing Don. I'd been to 3 different physical therapists, gone through an entire degree program and learned corrective exercise myself. And in one session of dry needling, I had more progress than I'd seen in 4 years of working on myself.
It's a very powerful technique, that's for sure.
So when I worked here with Gray and I apprenticed with Gray, my first year here, I didn't needle for most of that time, and I watched Gray go case through case and do a lot of needling, and I was just really, really impressed with the results, the outcome that he was able to change. Because of our remote location down here in Chatham, the patients I do see from Lynchburg, for example, I usually see once a week. If we have someone who drives from Nova or from out of state, and, it's usually once a week type of plan of care. And so being able to make as much change as we can in that brief period of time is really, really important. So the results are hard to argue about. Okay, Lawrence, I'm going to turn on the stem.
Mm-hmm.
Have we done this before, the stem?
Yep, I have.
Okay. You let me know when. Okay.
Starting to feel it now, but it's still comfortable.
Okay, you let me know when.
That's probably about right.
Okay, we'll leave it there for a little bit.
Sure, I'm really only feeling it on the right side. Is the left going, or am I spacing out?
Yep, they're both on the same
Alright, well,
same intensity.
You can see them twitching a little bit. That shaking is caused by your muscles contracting.
Right, from the stem. For those of you who've been in therapy before, like if you had a knee surgery, ACL, and you had Russian stimulation, this is that same idea. How about now, Lawrence?
feels good still. It's powerful, but I don't mind that.
Okay, good. We'll leave it sit for a little bit.
Okay.
One thing I've always wondered on, can you use dry needling on areas of the neck or something like the scalenes or something? Or are there certain areas that you...
It's all about risk. Certainly an area where there's a bony backdrop, much, much, much safer. anytime you're around the lungs or an artery, you need to be careful and very confident with where you're putting the needles. So for sure. So yeah, you can have your sternocleidomastoid needled, inferior obliquus capitis, even in the face, pelvic floor.
Wow.
All of that can be needled. Certainly someone who's got a lot of experience and training to do that.
For sure. And so needling is one area where you really need to know your anatomy.
Certainly because there's elevated risk. So safety is number one. Hippocratic oath, do no harm.
And I think you had told me earlier that you actually got certified in dry needling well before you practiced it yourself.
Yeah, and I had been watching Gray needle for a year, so.
And how long had you been a physical therapist before that?
2 years.
2 years.
Yeah, and it's something I had been personally interested in when I was in PT school. When I was in school in San Diego, the dry needling thing was starting to gain some traction. The American Academy of Orthopedic Manual Physical Therapists, they were talking about really bringing dry needling into the U.S. Because again, in Australia and Ireland and some other countries, it's a regular, practice of physical therapy. So a lot of states have adopted it into the physical therapy practice laws. There are areas that are fighting it, like California, New York, and Florida. Those are 3 areas where there's a lot of controversy and challenge between professionals. I think just recently Illinois and Tennessee lost the right to needle. Let's see, Delaware, physical therapists and athletic trainers can dry needle. That's some of the newest stuff that I can think of.
Why is it so controversial? It seems that this is a pretty powerful technique. What's the controversy?
Well, I think first off, when you just hear needle, immediately that elevates the responsibility of the provider. And traditionally, physical therapists aren't, thought of as someone who a professional that breaks the skin barrier. Even though physical therapists have been doing like TMJ, dysfunction, treatments, so actually going orally, or some pelvic floor rehab type stuff where there have been internal exams done, like coccyx manipulation. So there are areas where physical therapists have been, going inside the body to do treatments. But yeah, you put needle and invasive together, and I think there's a kind of a resistance, concern, fear. You've had a chance to see this. Sanitary, we use clean needle technique. It's systematic. It's palpation, confident. This was, I think, completely safe and well within my right to do as a physical therapist. I think the other side of this matter is professional competition, where acupuncturists and maybe chiropractors that also do some acupuncture, are concerned about clinical competition. That for me, that's never really been an issue. I think if you're trained to do something and you're safe and you're good at it, then I think you should be able to do it. Certainly dry needling currently is not a entry-level skill, so you're not going to go to PT school and learn how to dry needle. You're going to learn all the foundational sciences behind it and palpation and physiology to set you up for that, but it's certainly a postgraduate skill set to acquire. Much like thrust manipulation. You'll get a little bit of training in that in PT school, but there's lots of opportunities for you to learn more about that as you get out in practice.
Definitely. And as you can see here, she's still getting some nice twitches and contractions. And with the E-stim machine, Don can alter the frequency of those contractions.
That's actually what I'm going to do right now, Lauren, is just increase the frequency some. So they're going to be a little more rapid.
Cranking it up a little bit.
You doing okay?
That feels great.
Think of it as though we are uploading neuromuscular control or stability into her lumbar spine at the local level, so at the lumbar level, and also at the deep level. I think once you've seen the video, once you've seen this in person, I think it's much, much less intimidating and foreign and scary as it initially sounds.
Oh, definitely. When I had dry needling done for the first time, it can be a little uncomfortable because it's a odd sensation, but it's not painful, and the effects afterwards were pretty noticeable. I had been through my share of therapy experiences as well.
Perhaps another aspect of it that I really like is that you can't work in a model where you're in high volume. You know, I can't manage Lauren and 5 other patients at the same time and do this well and do this safely. So I like that it starts to show sort of a dichotomy in the style of practice, that for those who want to see lots of patients and get maybe average results, that's fine, let them do that. But I want to try to solve cases. So here in Chatham, Built a Practice is about providing a solution and not a service. So I'm not interested in just providing E-stim and a couple of exercises. I'm interested in trying to solve people's problems with them. So dry needling takes time, takes energy. It's a skill that you have to learn and practice. It's not something that you can do quickly and then hand off to an assistant or to a tech to do.
So it's the difference between making someone feel better and making someone feel better while solving the root of the problem in the first place.
Right, solution-based physical therapy, for sure. In fact, I would think that any professional at the top tier of their profession is seeking to solve their clients' problems. Whether they're a strength coach or a personal trainer or a physical therapist or a surgeon or a chiropractor, they're looking to solve their clients' problems. If you ever find yourself in a model or a situation where you can no longer take the time to think through each case, either that you don't want to or you're not allowed to from the administrators in your facility, then I would highly encourage you to find a different venue to work in.
Definitely.
Okay, well, I'm gonna turn that down.
Okay, cool. Thank you. I already feel better. It's amazing, just like, I almost feel like I can just feel the circulation improvement just from the stem, and haven't even stood up yet, and I can tell it's gonna be a lot better.
Yeah, definitely want to get you the video of her toe touch again. Both her subjective experience, does it feel any different, and then objectively, how much further does she go?
I think the really cool thing for me about needling is that my improvements have stuck. And
Right.
usually when I've done body work or manual therapy before, it'll be better for maybe a week, and then I'll
Sure.
go right back to where I was.
Yeah, because a short-term response, I think, is actually clinically, it's pretty easy to get. Especially if someone comes in with mobility deficits, so range of motion limitations, it's pretty easy to get a short-term adaptation. The question for me is always, it's not, did you use ART or did you use needling or mobilization or Mulligan or Maitland or whatever, McKenzie, but how long did your effects last? Okay, so they're all out.
Another factor as well is that with the placebo effect, if someone comes in to see a clinician who seems like they know what they're doing, it would be very easy for someone to feel better temporarily, even if the root of the problem wasn't really addressed.
Sure.
Want me to start getting up?
Go posture your rock. Chin to chest, chest to thighs. Yeah, just hang out there a little bit, do some breathing. And then when you're ready, check your toe touch again.
Mm-hmm.
How's it feel, Lauren?
I'm definitely going much farther than I was able to before. And I can feel flexion in my low back. I still feel a little bit of resistance, but it's so much better. All right, see if I can stand up and check this toe touch. So remember where I was before.
Yep.
I'm probably a good half a foot farther.
Yeah, before there
I'm
was
actually farther than that.
there's quite a big difference here.
Yeah, I still feel some resistance in my low back, but I'm still in the acute stage of injury, so I think Don would say that's probably pretty normal. I just have to wait for my body to continue healing itself, and if I had the time, I would probably come in for another needling session, but like he said, I'm coming all the way from Lynchburg, and I have other responsibilities, so we're just trying to get the best we can out of it.
For sure.
Yeah. And let's do a video of my rotation too, just because sometimes that gets better. So if you stand directly in front of me, let's see. So before I was hitting about 180 degrees with my shoulder, and now it's pointing towards the back cupboard. So I've improved rotation right side. Same thing left side, and I actually should show this to Don because I'm pretty sure this is the farthest I've ever rotated on the left side.
Yeah. Could you do the right side one more time for me? It's hard to tell. I feel like you might have a little bit more rotation on the left side.
I don't know. It's when I first came into him to work with him this past spring, I had about 10 degrees of rotation on each side. Literally, I could not rotate. It was terrible. And within one session, I regained probably 20 degrees. So it was pretty great. Yeah, thanks for watching.
Alrighty.